Yeah.
So again, for the information of everyone, this demo class is recorded, and this will be also shared to other participants who are missing the class and who has requested for the recording. And again, if you have any problems with the recording, please feel free to message either Karen or myself, and we can arrange another session for you where it won't be recorded. We are doing an acid-base balance, and we are from NETA. So just a quick background of myself. My name is Carissa. I am the education manager for NETA, and I am a registered nurse myself, a nurse educator. And background-wise, I did my emergency department experience for 2 years. Then I did neurosurgical urology, plastics palliative, and vascular. And now I am in the education sector. So I did look after new graduate nurses in different health districts. And then I also did teach the bridging course. And now I'm teaching NCLEX and OSCE. Co-facilitating with me today is the OBA course coordinator, which is Karen, and Karen will be introducing herself.
Hello, wonderful morning, everyone. I am the OBA course coordinator of Nursing Education and Training Australia. I am also a nurse myself, and I have been working in a different areas of nursing. I've been an educator as well. I've worked in ED, I've worked in the medical surgical, and I worked in ICU back then. I've worked overseas. Then I moved to Australia. Now I'm a director of nursing in one of the day procedure surgery here in Melbourne. So I'm really excited to meet all of you, and hopefully we'll proceed and for more classes in the future as well. So yes, we are happy to proceed. Our lesson for today is about acid-base balance. Are we happy to push through, Carissa, or would like to say anything else as well?
Yeah, all good. I just wanted to say thank you to everybody who's really spent the time to have some time with us to be able to learn about acid-base balance. As we all know, this topic is a topic where it can be confusing at times, or sometimes it can be very tricky when it comes to NCLEX question. So again, for those who have just joined in, this class is recorded, and please send us a message if you have any troubles with recording this video. All right, so let's start with the very basic concepts that a registered nurse must know. Karen, would you like to go through?
Yes, we will be discussing this in details later on. So, what are the concepts that you should know as a registered nurse? You have to understand the buffer system that includes your hydrogen ions, your ABG reading, especially that includes your acids, your bases, your blood gases, respiratory acidosis, the concept of that as well, behind that, the pathophysiology that's causing respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. So those are the concepts that you have to by heart when you are reading and when you are learning about acid-base balance. So we could proceed to the next slide.
Thanks, Karen. Just a question from everyone, and you can do a hands up or a smiley face, a reaction in your Zoom, or you can talk as well. Um, who among you, ha- who among you have encountered these words? Are these words new to you? Are these words very familiar to you, or are these a concept that you've already heard from before?
We have already heard before.
Yeah,
Yes,
you've learned from before.
yeah.
Perfect. Anyone else?
I'm familiar with most of the words.
Perfect.
So another question from me, if you will be presented with a laboratory value regarding ABG. How confident are you that you will be able to read it correctly? Who among you here are confident reading an ABG? Hands up. Oh, I could see from Paramjit. Well done. Yeah, so so that's one out of many. I hope there are others who are also shy, but definitely that is our goal here, for you to be confident when you go out of the class.
We want you to go in your NCLEX test or the exam itself, where you don't have to memorize arrows up and down. We want you to go there in your exam very, you know, your brain or your head is very light, that no matter how much NCLEX will be asking you these questions, these are the questions that you can just close your eyes and say, yep, I know it's metabolic acidosis, compensated, non-compensated, partially compensated. So that is our main goal for today. So thank you so much to those who have sent their message. So yes, somebody said it's very familiar, 10% if I did not go to this lecture.
That's really funny.
Yep, the other one says familiar, and the other one says not confident. I'm seeking entry in the healthcare field and needs refresher course on this topic. And that's why we're here today. So that's very good. And thank you very much for your honesty. So let's proceed. So let's start with hydrogen ions, acids, and bases. This is a concept that I want to simplify. So everything that is happening right now in our body, while I am talking, while I'm moving my hands, when I'm walking, while everyone now is listening, there is a change of the pH level in our body. So it is because of the hydrogen ion that goes in and out of the cell to maintain that homeostasis. So I think everybody would understand that, whether or not your heartbeat is so fast at the moment or your heartbeat is so slow at the moment, there is something that is happening in the cellular level. And that is where, if you would have a very solid knowledge of fluids and electrolytes, which we will be putting through as well as a demo class in the future, but you can see that there is exchange of potassium, change of sodium, change of chloride, change of phosphorus, and all of this affects the acidity of the body. So you can see that most of the patient who's experiencing acidosis would have high potassium level, for example. So your hydrogen ion plays a very important role in maintaining the acidity or the alkalinity of your body. And it's all of our bodies. So there is this what you call homeostasis for us to be able to function well. And this is the reason why our hydrogen ion goes in and out of the cell to maintain that pH level where we can function normally. So there is a pH level in the extracellular level, which is your intravascular. That's where we draw the blood, our ABG, where we can see that the pH level is actually normal. There are instances, some conditions where we have this, say, accident, for example, or overdosage of a drug, or diarrhea, or prolonged vomiting, for example, where it can change the pH level. So pH means the pressure of hydrogen ion, which means that's the number of hydrogen ion in the intravascular space. So who can tell us what is the normal pH level in the body? It's not the urine, it's the blood level.
7.35.
5 to 7.45.
Perfect.
Perfect.
So 7.35 to 7.45. And what does it mean? If your pH level is within that stage, 7.35 to 7.45, that means that the body is actually in homeostasis, whether the body is compensating with the changes or it's just a normal pH level. That means your body is able to function normally in that pH level. What if the hydrogen ion in the intravascular space becomes more? There are a lot of pH. There's a lot of hydrogen ion. What happens?
Alkalosis.
alkalosis, which then goes to the blue side, which is then basic. So anything that is more than 7.45 is actually considered alkalinic or alkalotic or basic. Okay. If there is lesser hydrogen ion for some reasons, it went intracellularly because of some reasons, what will happen to the pH level? It
Acidosis.
decreases and it becomes
Acidosis.
acidotic.
Acid.
So, yep, so anything between, anything less than 7.35 is actually acidotic. So let's put that. So that's less than 7.35 and more than 7.45. For the body to maintain homeostasis, it should be between 7.35 to 7.45. And that's how simple it is. Karen, I'll proceed to the next slide.
Okay.
Sorry, I just have to delete that.
So, okay, so when we talk about the buffer system, so there are actually three things or three responses that our body might, react to changes in acidity or changes in alkalinity in our body. So the first response is done by our hydrogen ions. So for example, when there is a change in our body, our system, our fluids in their body has actually, like for example, phosphate, protein, and ammonium that is easily able to attach to the excess hydrogen in our system. So those things are free flowing in our body. There's nothing extra that's going on like our lungs or our kidneys. So that's the first response that's going to happen to our system. However, if the first response does not actually neutralize the pH in our blood, what will happen? The second response will occur. When you say second response, that is actually our respiratory system. So what will happen to our respiratory system? Our brain will signal to our lungs that there is an imbalance that's happening. So if there is an imbalance that's happening in our system because our free flowing fluids in our body was not able to neutralize our pH, our brain will signal to our lungs. If there is an increase in carbon dioxide, it will ask our lungs to slow down the respiration. So it will make it more alkaline. Or if there is an excess in carbon dioxide that is causing the acidity in our body, that's making it more like there will be hypoventilation. If there will be decrease in carbon dioxide that is causing the basic pH in our blood, then our brain will signal to our lungs that our lungs should breathe more. Okay, so that's how our lungs actually try to buffer the system, our pH, if our first buffer does not work. When our lungs as well does not compensate and make our, let us say, body go back to normal in pH, our renal system will also take into action. So what will happen to our kidneys? What do you think happened if our lungs is actually working as well to make the body's pH normal and it doesn't work? What will our kidneys do? You can see here in the picture, it's actually responsible for the bicarb in our system to neutralize the acidity of our body. So if there will be increase in bicarb, which is your HCO3, what will happen to the system or what will happen to our body? Increase in bicarb?
Alkalosis.
It becomes alkalosis. And if there is decrease in bicarb?
Acidosis.
Acidosis. So if you're going to think about it, what is your normal PaCO2?
35 to 45.
35 to
35
45.
to 45.
35 to 45. What is your normal HCO3?
22 to 26.
22 to 26. Your 35 to 45 PaCO2 is actually talking and measuring your carbon dioxide. So if it is increased, it is acidic, okay? Your 22 to 26 is actually measuring your HCO3. When it is increased, it becomes alkalotic. They are inversely proportional. So that's what you have to remember. They are inversely proportional. So we will be able to have a clearer picture when we go to our examples later on.
Thanks, Karen. I'd like to add to that one. So, all we need to remember is that hydrogen, lungs, and the kidneys are actually best friends. They help each other. The only thing is the hydrogen is the bravest. So the hydrogen takes the action first. So you can see this one in the changes of your hydrogen ions. Either they have the capacity to attract or the capacity to actually detach themselves from different types of electrolytes. So say for example, hydrochloride. So hydrochloride is an acid itself, but when there is a lot of acid in the body, then they will detach from the chloride just to make sure that there will be no more acid formation in the body. And that's how this hydrogen ion actually buffers. So we remember this is from Mosby, one of the very good visual resource that we would recommend our students. Buffy buffer. So Buffy buffer is the first one. So in military, they're the first line of defense. There actually are WBCs as well when it comes to the what do you call this? The bloods or blood works. So in acid-base balance, they're the first one. They're the bravest. If hydrogen does not have the capacity anymore, because they get exhausted as well. So there are probably, when we exhaust all hydrogen ions, for example, then hydrogen ion, as what Karen said, will give a signal to the brain, hey, I'm not coping up at the moment, give me my friend. So hydrogen's friend, which is the lungs, will then come into action, and this is where the lungs will have the capacity to either blow off or retain the carbon dioxide. So this is what Karen was saying, that carbon dioxide is then associated with an acid because of the carbonic acid, which is HCO3, H2CO3. H2CO3. So with the high content of carbon dioxide in the body, that is considered acidotic. With a low content of carbon dioxide in the body, that is called alkalosis. So if the body is very acidic, then what will the lungs do is it will puff out all the all the carbon dioxide. Okay, so you can see this, that when there is acidosis, whether it is respiratory acidosis or metabolic acidosis, you can actually see that this patient is actually puffing out this carbon dioxide. We don't need more carbon dioxide in the body. If the body is alkalinic, which means we need more acid, the body will actually retain this CO2, and that's where Karen said there is hypoventilation, because we don't want this CO2 to go out of the body. That's the reason why these patients are actually hypoventilating, or not breathing as much as they can. And then the lungs will say, oh, I'm so tired already of breathing in or breathing out or puffing out CO2 or retaining CO2. I can't maintain the pH level anymore. And that's where the kidneys will come in. So the kidney said here, in that image, it says, I'm slow but dependable. I control bicarbonate to neutralize it. So this is where the kidneys actually come in. I'm the last one to come in. I am the super best friend of these two because I will save these two. So the kidneys will come in. They're the last one, but they're very dependable. And this is where they have the capacity to either retain or push out HCO3, which is your bicarbonate. Bicarbonate is basic in nature. So when the kidneys go into action, they will say, okay, the body is very acidic. The body will need more alkaline. I will retain the bicarbonates. Or if the body is very alkalinic, the kidneys will then say, okay, they don't need a lot of HCO3. I have the capacity to actually release this HCO3. Okay, so that is the reason why they are all best friends, and that is the reason why it's called a buffer system, because they do buffer. They do, how do you call a buffer? When probably when you were young and you were not allowed to go out, for example, to go for disco or nightlife, there is that when you come home, your mom always buffer, always protect you from being scolded by your dad. Okay, so your mom always stay in the front line. No, 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 no. It's okay. Carissa did not do bad. Carissa is just going out with her friends. That is a buffer system to make sure that you don't get hurt by your dad. So that is why we have a buffer system in acid-base balance so that the body doesn't get hurt. The hydrogen, the lungs, and the kidneys actually protect you from being hurt. And that's where the buffer system comes in. So there are three things that you need to remember in the buffer system. Thanks, Karen.
Thanks, Carissa.
Another concept that we need to know would be the blood gases, because this is how we're going to determine whether the body is acidic, whether the body is compensating, whether the body has compensated or not. So let's start with the normal values. So everybody said here that pH is 7.35 to 7.45. Is that true?
Yes.
Yeah.
Yes.
And we said that the higher the level, the more basic it becomes. Is that correct?
Yes.
And the lesser the level, the more acidic it becomes. Is that correct? Yeah, perfect. Now let's go to our PaCO2. Karen said a while ago, what was the level again?
80 to 100.
We're talking about carbon dioxide, partial
45 to
pressure.
45.
45 to 35.
35 to 45. And we always associate CO2 with an acid. Is that correct? Yeah. Therefore, if there is too much CO2, is it acidic or basic?
Acidic.
Acidic. If there is very less CO2, is it acidic or basic?
Basic.
Basic.
Okay, so if it's more than 45, we say it is acidic. If it's less than 35, we said it is basic. This is actually measured in millimoles per liter. HCO3, again, with PaCO2, it is the lungs' capacity to either puff out or retain the CO2. Okay, with HCO3, whose talent is this? It is the kidneys' capacity to retain or blow out, or not blow out, excrete HCO3. So we said that HCO3 we consider basic. Is that correct?
Yes.
So what's the normal level of HCO3?
22 to 26.
22 to 26. In saying that, the more HCO3, is it acidic or basic?
Basic.
Basic. And the less HCO3, is it acidic or basic?
Acidic.
Acidic. So this is where Karen said a while ago that they're actually inversely proportional. Yeah. So the more the more CO2, more acidic it becomes, the more HCO3, the more basic it becomes, and vice versa. Is that understandable at this stage?
Yes.
Yes, perfect. Now, the partial pressure of O2 is also different from your saturation. Okay, so do not confuse this in your NCLEX, because PaO2 is 80 to 100. That is the normal PaO2. That means this is the amount of oxygen in your arteries, not in your O2 saturation probe. Okay, so do not confuse this with your O2 saturation. It is very important, though we don't consider PaO2 in an ABG reading, but it is very important for us to actually identify whether this patient is hypoxic or not. Okay, and that's why it's very important for us to know the PaO2, because we will know that if there is hypoxia, we need to attend hypoxia first, because it is your breathing in your ABC. Okay, so it's 80 to 100. Is that clear at this stage?
Yes.
Yeah, beautiful.
So part of our acid-base balance, we were talking about the respiration, how our lungs is actually trying to neutralize. However, one of the issue and the problem when there is an acid-base balance is what we call your respiratory acidosis. So from the concept that you have learned earlier, and even with the drawing, you could see here that there's a very good visual for, especially for those who are visual learners. So when there is respiratory acidosis, what do you think is the range, or what do you think will be the reading of your PaCO2?
pH is high, low.
pH is low, it's acidic.
PaCO2, when you say PaCO2, because this is what we are looking at here. So when you say respiratory acidosis, what do you think is the reading? Is it more than 7.45, or is it gonna be less than 7.35?
More
Less
than.
than 7.35.
More than 7.45. Remember what Carissa has said, we are actually measuring the CO2. And when you say CO2, it is actually acidic. So you are seeing here that there is a respiratory acidosis. So when there's a respiratory acidosis, what will be the reason? So one of it is oversedation. When you oversedation actually results in hypoventilation. So if there is hypoventilation, there will be poor oxygen absorption, or there will be poor intake of oxygen into your lungs because you are actually breathing less than the normal. If there is a brain trauma, that could also cause respiratory acidosis. Acidosis. Because that could also affect your breathing. Immobility could also affect your breathing. Respiratory muscle paralysis. Any issue that could actually cause poor oxygen intake to your lungs. Okay, so when you say, it means to say in this scenario, there is increased carbon dioxide in your body. There will be increased carbon dioxide in your body. Sorry, I said 7.45 here. I was saying it's supposed to be more than 45. Okay, it's more than 45, and it's gonna be less than 7.35 pH. So I stand corrected. So the concept that you have to remember when there is respiratory acidosis, there will be increased carbon dioxide in your body, and that's it. Okay, and what are the things that causes increased carbon dioxide in the body? These are the things that you could see here. Okay, pneumonia, for example, there will be poor exchange of oxygen to your blood because of pneumonia or because of the bacterial infection to your lungs. Pulmonary edema, that also is affecting your breathing. Emphysema, bronchitis. So those factors could actually cause increased carbon dioxide in your system. So if there is increased carbon dioxide in the system, your PaCO2 will increase to more than 45, and your pH will decrease to less than 7.35. Do you understand? Does it
Yes.
make sense? So that's what is causing your respiratory acidosis. Sorry. Yeah. Carissa, I cannot hear you.
Oh, sorry, I was talking in mute. I said that 2021, the very common phrase is "you are on mute." And so as 2020, it has continued in 2021. All right, so Karen has explained respiratory acidosis, where there is high amount of CO2 in the body. Okay, when we talk about respiratory alkalosis, there is low amount of CO2 in the body. So again, we say that CO2 is between 35 to 45. The more CO2, the more acidotic it becomes. The less CO2, the more basic it becomes. Is that correct when I say that? Yeah.
Yes.
All right. So in this case, when what are the incidents or in what situation where the body actually blows off CO2? Because there's less CO2, right? So in what cases does the body blows off CO2 or less CO2? So number one is actually anxiety. When a patient or when a person is very anxious, when a person is coming from a fist fight, for example, or when a person is coming from an argument, for example, what do we notice in these people? They're actually breathing more. It is called hyperventilation. If you work in the ED, you would actually see that they are the ones who would need the paper bag. Why do they need the paper bag? Because we don't want them to keep blowing off CO2. We want them to retain their CO2 to maintain the acid-base balance. So in that case, hyperventilation with anxiety can actually cause respiratory alkalosis. So when they go to your emergency department, in NCLEX, it will be asked as a question with a history of, say, a person who just ran because of seeing a snake, for example. Okay, so when this person is running because of he or she is scared because of seeing a snake, there was anxiety there, and you can see that this person is actually hyperventilating. And that's where there will be a lot of blow off of CO2, and then their CO2 level goes down to 35, and that causes respiratory alkalosis. Long-term pulmonary disease. So I understand that Karen was saying a while ago, pulmonary disease actually causes respiratory acidosis. So if that's your lungs, and in your lungs, let's make it big, that's your alveoli, for example. In your alveoli, there is this vein as well. So there is a change of oxygen and carbon dioxide. Is my drawing clear? So there is O2 exchange putting into the vein when the body breathes, and then CO2 going out to the alveoli for the body to exhale. There is a very there is a very poor exchange of these gases, and so in the initial phase there is high CO2 level, and that is the reason why there is respiratory acidosis. In a long-term process, the pulmonary disease, people are actually with pulmonary disease like COPD, emphysema, they're actually puffing more CO2 out because they're breathing more, they're hyperventilating. And that is the reason why it can also cause respiratory alkalosis in the long term. There is what you call ventilator settings, too high or too fast. So we have the ventilator settings where we have a PEEP pressure. I'm not sure if somebody works here in ICU. So if that's your alveoli, normally the expansion of our alveoli would be within 2 to 4 plus, and that is that is what you call the PEEP pressure. Okay, so that is the pressure of oxygen that we actually put in the alveoli in a ventilator setting. So in that case, if the ventilator setting is too high, so because there is a COVID, for example, where there is water in the alveoli, in the ventilator, we extend the pressure. We make the alveoli a bit bigger. So sometimes we put 5 to 8 positive. My uncle who had COVID actually went up to 16 positive of the setting of the ventilator. What happens there? There is more oxygen. And what happens with more oxygen? There is less carbon dioxide. And the lesser carbon dioxide, again, will cause respiratory alkalosis. And that is the reason why people who are actually on high ventilator settings, we also check for respiratory alkalosis, because we don't want them to have high oxygen flow and lesser CO2. Then we've got high altitudes. Why do you think so? Anyone? I'm from the mountains, so I would know this, but anyone, Mount Everest, why do you think there is a higher chance of respiratory alkalosis in these high altitude places?
Less oxygen.
Oxygen over there.
And in that case, if there's lesser oxygen, what will happen? We breathe in more. We are actually pumping out more of the CO2. And therefore, pumping out the CO2 will make the body basic. So it's respiratory alkalosis. So there is this question, do I need a rebreather bag when I pant? That is just a funny description of a dog. Probably when the dog is anxious and is super stressed, yes, they will need the paper bag. So the basic concept here is respiratory acidosis, high in CO2. And those were the signs, the conditions that Karen was talking about. Respiratory alkalosis is when there is less CO2 in the body.
Thank you, Carissa. So let's proceed and move. We will be talking about metabolic acidosis. Carissa has given the difference between respiratory acidosis and respiratory alkalosis. Now we move to metabolic acidosis. So we've mentioned earlier, we were talking about your HCO3. So again, your normal HCO3, your serum HCO3, what was that? I could see a lot of people trying to talk, but you're on mute.
22 to 26.
So you have your 22 to 26. So if you say metabolic acidosis, is it going to be less than 22 or more than 26?
Less than 22.
Less than 22.
So you have less than 22 because your HCO3 is actually basic, as what Carissa has mentioned earlier. So now we will try to analyze what will make your body basic metabolically. So you have actually a very good drawing here. So one of it is your ketoacidosis, your DKA.
Sorry, Kyle, we're talking about acidosis.
Yeah.
Yeah.
Metabolic acidosis, sorry. We're talking about, we have here metabolic acidosis, DKA. So you have even here 500 in the drawing, DKA is more than 300. That's very, very high. So why do you think your DKA is actually causing metabolic acidosis? Yes, I can see a lot of people trying to talk or no. So that's the thing. We have to know why, because we cannot just say it's causing metabolic acidosis. It's causing metabolic alkalosis. So what is DKA? So what's happening there? What's happening to your body if you have DKA? Your ketone bodies. Yes, your ketones, beautiful. It's actually
Yes.
acidic in nature.
Yeah.
Your ketone bodies are actually acidic in nature. That's definitely gonna cause your metabolic acidosis. All right. So another thing or another cause of your let us say metabolic acidosis is your shock. What do you think will happen with the shock?
RC.
Yeah, I could see Seth, what do you think will happen in shock? Why it will lead to metabolic acidosis?
Retain of carbon dioxide.
Beautiful. There will be retention of carbon dioxide, and there's the retention of your carbon dioxide. There's actually formation of your lactic acid in terms of shock. Okay. How about diarrhea? Why do you think it could cause metabolic acidosis with diarrhea? What are you
Expel out of
Potassium.
expel out of I forget that one. Alpha something. Then
It's actually, yes, you have the thought says, but it's actually excreting your sodium bicarb, your HCO3. All right. And the last one in your drawing, you could see here, we just can't secrete ions or reabsorb bicarb. So there is a problem with your kidneys. So that's causing your metabolic acidosis. So then what do you think will happen? What are the signs and symptoms do you think if there is metabolic acidosis? What will happen to your patient? So now you are thinking, okay, there will be acidosis. So your body will try to compensate. You could actually notice your patient having Cosmos respiration, for example, because it's trying to breathe in more oxygen to neutralize the acidity of your body. So that's just an example, okay? So does it make sense? Do you understand it better when we explain and we have this picture with you? How your metabolic acidosis works or how your metabolic acidosis happens in your system?
Yes.
Okay, beautiful. So we are happy to proceed.
Another thing I'd like to add there is this picture, which is very good. So you can see here that with a metabolic acidosis, there is actually that release of the bicarbonate. And you can see that in your severe diarrhea. Okay, so, and that is the reason why in a long-term diarrhea, there is um, a high release of your bicarbonates as well. Another thing you'd like to consider with acidosis is anything that the body produces that is acidic in nature. So say, for example, drug overdose that contains a lot of toxins. So any kind of drug overdose actually gives a lot of acid to the body. There is that inflammatory process where your leukotrienes, cytokines, and um, all other chemical components of the body just go out intravascularly to save the body. These are all acidic in nature. Your shock, which is what Karen mentioned, your lactic acid, your ketoacidosis, which is your ketones, which is acid in nature. So anything that is acidic component of the body that goes in bulk is actually called metabolic acidosis. So when it comes to the lungs, it is respiratory, but any other system in the body is metabolic. Okay, so that is metabolic acidosis. On the other side, we have metabolic alkalosis. The only question that I want you to remember here is this one, the one that the dog is asking. Where did all the hydrogen, calcium, and potassium go? Any loss of this will cause metabolic alkalosis. Okay. Where did the potassium go? Where did the hydrogen ion go? Where did the calcium go? So say, for example, let's talk about the right side first. TPN. TPN contains a lot of basic in the body. It's nutrients, and even if you taste it, it tastes like bicarbonates because of the high content of the alkalosis. Basic components. Citrate as well is alkalinic in nature. So as when you do your CPR, when you do your resource, we're actually giving a lot of bicarbonates to this patient, and hence that will cause metabolic alkalosis. Very common in NCLEX though, and this is very common, is when there is a release of the hydrogen ion. Hydrogen, I always associate them with water. Okay, so when there is a loss of that hydrogen ion, whether it's a prolonged vomiting or nasogastric suction, that is where you would see a metabolic alkalosis. Thiazide, on the other hand, is already alkalinic in nature. Okay, what you need to remember in your NCLEX, because this will definitely come out if you have alkalosis, is that any loss of your hydrogen, calcium, potassium, and very common example for NCLEX is your nasogastric tube, prolonged vomiting, use of bicarbonates, and your citrates infusion, or even blood or TPN transfusion. So these are very common NCLEX questions. And if you remember that if there is any loss of your hydrogen ion, then that is where your metabolic alkalosis will take place. So looking into the number again, HCO3, the more HCO3, the more bicarbonate ions you have, the more basic it becomes. So with your level, how much is this one? So it should be more than 26. That's where you can say that there is alkalosis. Okay. I think now we know the causes and what are the manifestations of these patients when they're on metabolic acidosis, respiratory alkalosis, metabolic acidosis and alkalosis. We need now to know how to read an ABG. Okay, so this is our favorite part, because in NCLEX, this will come out as well. You need to interpret whether or not this is metabolic acidosis alkalosis, respiratory acidosis alkalosis, whether it's compensated partially or fully, or no compensation at all. So Karen, do you want to do the first one?
Okay. Let's try to give an example because it's easier to understand when we give some example. So let's talk about uncompensated respiratory acidosis. So don't mind my handwriting, because we are talking about uncompensated. Okay, so when you say uncompensated respiratory acidosis, what do you think will be the pH? Is it going to be more than 7.45 or less than 7.35?
Less than 7.5.
Less than 7.
Less than 7.35, perfect. Then we will go to the an example later on. So it will be less than 7.35. So what do you think will be the PaCO2? Is it gonna be more than 45 or less than 35?
More than 45.
Perfect, it's gonna be more than 45. What do you think will be your HCO3? Is it gonna be normal? Is it gonna be more than 26, or is it gonna be less than 22?
Normal.
Beautiful. Perfect. So your HCO3 will be normal. HCO3. The thing here is that when you say uncompensated, it means to say that your HCO3 did not do a thing. Carissa's example, I like to use it. If your HCO3 is a boyfriend of your pH or your body, it did not do a thing to make this feel better. It did not give a flower, for example. Okay, it did not make an effort. So no, I will not make an effort. I'm tired. I want to rest. I'm normal. No problem. He did not make an effort. Your HCO3 just didn't do a thing. So that's your uncompensated. Okay. So that's about it with your respiratory acidosis. I'll give an example if it is a metabolic. Okay, let's clear this out. How about uncompensated? Metabolic alkalosis. Okay, what happens to your pH? Is your pH high, more than 7.45, or is gonna be less than 7.35? Your pH
More than 7.45.
more than 7.45. It's because it's alkalosis. Okay. How about your PaCO2?
It's more than
Normal.
20.
It's normal.
It's
Normal.
normal. It did not do a thing because it's uncompensated. Remember metabolic, it's talking about your HCO3. In this scenario, your HCO3 is what? Is it gonna be more than 26 or less than 22?
More than 26.
More
26.
than.
It's gonna be more than 26. Beautiful. You're actually doing it great. So again, when you say uncompensated, the buffer, either 2 or 3, when you say buffer 2, which is your lungs, buffer 3, which is your kidney, either of that is not doing a thing. Okay, so when it's metabolic alkalosis, it's your kidneys that made the pH of the body different. When you say respiratory, it means to say it is your lungs that is making the pH of the body different. Is it clear in that manner when you say uncompensated? Very clear, very good. So Carissa could proceed with partially compensated.
Thanks, Karen. I like when you raised that example about the boyfriend and the girlfriend. Okay, so something that will make you remember, not memorize, when you go to your NCLEX real test, is that when you say uncompensated, Karen said that the buffer system, these best friends are not doing a thing. Say, for example, you and your husband are fighting. I know that we have one male here. What's his name again? I was mentioning his name a while ago, but say, for example, you're fighting with your husband. So everything is not normal because you're fighting with your husband. Here, Bharat. Say, for example, Bharat is fighting with his wife. So in that case, the pH level is not normal. Okay, so when you say uncompensated, the pH level is not normal. Whether it's high or low, it's just not normal. They're fighting. Not compensated means that the wife or the husband did not do a thing. This means if it's respiratory, the kidneys didn't do a thing. If it's metabolic, the lungs didn't do a thing. So it becomes abnormal and no help from the buffer system. When you say partially compensated, yes, somebody did a thing, which is good. Either the lungs did something or the kidneys did something. However, it did not succeed. Okay,
It was not
so
enough.
it wasn't enough. So say, for example, you're fighting with your husband. pH is not normal because you're fighting with your husband. However, your husband gave you flowers. Your husband said, I'm so sorry. Your husband did something to make things up. However, you're not satisfied. So your pH level still remains abnormal. However, you can see an effort there. Okay, so let's have an example. So say, for example, there is respiratory acidosis. Okay, so this patient has prolonged pneumonia, for example, because there is high CO2 level. So in that case, your pH level, because it's acidosis and it is, there is acidosis there. So what will happen is it's less than 7.35. So say, for example, 7.20. Yeah, that's acidosis. But because of the pneumonia, there is high level of CO2 because it is acidosis. So it should be more than 45. So say, for example, it's 50. But because it's partially compensated, your CO2 is high, so it's acidotic. Your kidneys is trying to help. Yeah, the husband is trying to give flowers, for example. Let's put that analogy. So in that case, what will happen? The kidney will make it more acidic or basic? Basic.
All basic.
Yes. So therefore, making it more basic would be more than 26.
26.
So if the HCO3 is more than 26, let's say 28, you can see that the kidney is helping to make it more basic because of the acidic nature. However, the kidney did not succeed. So it is still abnormal, but it is partially compensated. Why? Because the kidneys were helping.
There was an effort.
There was an effort. It wasn't just successful. Okay. The kidneys gave flower to the lungs. Hey, lungs, I'll make things better. But then the lungs just didn't mind it. And so it becomes, it's still abnormal, but there was an effort. Okay. So that is partially compensated. Let's have another example. Say, for example, we're talking about metabolic acidosis. So this patient actually has, say, food poisoning. Okay, so there's a lot of toxins in the body, okay, because of the poison. So in that case, the pH level is acidotic, isn't it? So it should be less than 7.35. So say, for example, it's 7.30. Is that acidotic?
Yes.
Yes. When we say metabolic, who is responsible?
HCO3.
HCO3. So with HCO3 being acidic, is it high or low?
Low.
Low. So the more HCO3, the more basic, the less HCO3, the more acidic. Am I right in saying that?
Yes.
Yeah. So say, for example, HCO3 is 20. So that is actually a metabolic acidosis. If your CO2 did not help at all, remains normal, I don't care. There is, the kidneys will manage itself, I don't care. Then that becomes uncompensated. Yes, but if the CO2 cares, because this is acidic, the CO2 will make the body acidic or alkalinic?
Alkalinic.
Alkalinic. So is that more CO2 or less CO2 in the body?
Less CO2.
Less CO2. So say, for example, CO2 becomes 30. It's trying to make the body alkalinic. It's giving an effort. It's trying to save the body. However, the CO2 was not successful. So you can see that it is still metabolic acidosis, but there is partial compensation because the CO2 did help. Did you get that?
Yes.
Yeah. So if there is helping hand, but still not successful, the pH level is still abnormal, that's partially compensated. Thanks, Karen.
Thanks, Carissa. So we have mentioned earlier about uncompensated, and Carissa has mentioned about partially compensated. So uncompensated, there was no effort at all. Partially compensated, there was an effort, but it was not successful. But when you say fully compensated, it was a success, okay? So when you say it was a success, it means to say that your pH, what will happen to your pH if that's a success?
Normal.
Going to normal.
Beautiful. It's gonna be normal. However, when you say if it is a respiratory acidosis, fully compensated, what is your PaCO2? Is it gonna be more than
More than
45?
40.
Beautiful, it's more than 45, okay? How about your HCO3? Is it gonna be more than 26 or less than 22?
More than 26.
It's gonna be more than 26 because it tried to help and it was successful, okay? It tried to help and it is successful. In this situation, this is actually tricky, okay? Carissa and I will be giving you a trick in this because what if this was not given? Say, for example, remember your patient a while ago was having a respiratory acidosis, fully compensated. But let's put a number into this. Okay, let us put this, for example, your pH is actually 7.36 and your PaCO2 is actually 48 and your HCO3 is actually 28. How, my question for you right now, you don't know what is the diagnosis, okay? However, now you get confused because you are actually having normal here. But here you have abnormal PaCO2, you have abnormal HCO3. How can you tell that this is a respiratory acidosis fully compensated?
Because it's near to the acidosis, like if it's
Beautiful, Ripa. Beautiful, Ripa. Not a lot of us, maybe you forgot about this trick as well. So this is very important for us to know if this is actually a respiratory acidosis fully compensated. Because if you don't know this trick, you could always say, oh, this is a metabolic alkalosis fully compensated, isn't it? Because it's normal here. However, your PaCO2 is acidic. Your HCO3 is alkalotic. But Ripal was able to mention here that this is actually a respiratory acidosis because your pH is actually in the acidic side. So when you say it's in acidic side, and you will see more of this with Carissa's video in our portal when you enroll with us, she really did a very good example and a very good explanation of how you will be able to understand this clearly. Okay, that's the hint. That's the thing. That's the hint. If you enroll with us, and Ripal was able to point it out immediately because of the pH, which is actually in the acidic side. It is explained there in details. We will also have an example later on in which you will have this trick as well. You will be able to point it out even without the diagnosis. You will say, oh, that's a respiratory acidosis fully compensated. Definitely, if you have the diagnosis, patient having COPD, you'll definitely know immediately because the patient is having the diagnosis of having a lung problem. But blind, just being given you the ABG by the doctor. Okay, Paramjit, can you please help me? I'm confused. Will you be able to say, oh, that's respiratory acidosis fully compensated? No, right?
Yes.
Even I will not know if I don't know the trick. So in our video, in our portal, you'll be able to see a very good example and a very good description in that. And hopefully we could be able to show you as well during our example later on. So watch out for that. That is a
Thanks.
very good thing.
Thanks, Karen. So I think in summary, we will say uncompensated is an abnormal pH. No one is helping. Partially compensated is still an abnormal pH. Somebody is helping. Fully compensated means there is something abnormal, either the lungs or the kidneys. However, they were successful. So the pH level goes back to normal. Okay, so the body actually compensated fully. So there is also what Ripal was saying about the acidic side and alkalotic side. So when it is fully compensated, our normal pH is 7.35 to 7.45. But from 7.35 to 7.40, this is actually an acidic side of our pH. Not that it is acidosis, it's just an acidic side. Okay, when we talk about 7.41 to 7.45, this is your alkalinic side. Not that it is alkalosis, but it is in the alkalinic side. So question, when you have a temperature of 40 degrees Celsius, you've taken paracetamol. After an hour, you checked your temperature. The first temperature is 37.9 degrees Celsius. The second temperature is 36 degrees Celsius. Which one is more realistic? After a 40 degrees of temperature. This is outside of the topic. This is just my question. Sorry, Seth, you were saying something.
Realistic is 37.9, I think.
37.9. Perfect. What does that mean to say? Our body does not overcompensate. Okay. What does that mean in an ABG reading? If it is an acidosis, if the body is feeling acidosis, the normal pH level, if it's fully compensated, will actually not go to the alkalinic side. It is actually the acidotic side because your body does not overcompensate. Okay, so if you have respiratory acidosis, your normal pH level when it's fully compensated should be between 7.35 to 7.40. Okay, when it is more than 7.40, the body is overly compensating. It's like having a 40 degrees Celsius after paracetamol, your body became 36 degrees Celsius, which is unrealistic. We will have more example to this, but this is a hint for you. If you don't know the diagnosis of your patient, your body should not be overly compensating as well. Okay, so let's have an example. Let's read this ABG. Karen, do you want to do it first or do you want me to do it first?
Yes, I can do it first.
Okay.
I love ABGs, so it's okay. Okay, everyone. So we can see here that we have a pH of 7.32. With that reading, just one look, and we will analyze together. What do you think is the answer here?
Respiratory acidosis.
Respiratory acidosis? Is it, so we have to complete it then, because we already learned earlier there was uncompensated, partially compensated, and fully compensated. So what is this? Is it a uncompensated?
Fully.
So this is a what? I could hear somebody said uncompensated, partially compensated, fully compensated.
This is
Uncompensated.
Uncompensated.
because that was-
Uncompensated, very good. So why do you think it's respiratory acidosis uncompensated? Let's try to analyze together. pH 7.32. So what is your normal again?
7.35 to
7.45. So thereby your pH here is what? Acidic, alkalotic?
acidic.
Acidic. Very good. PaCO2, 49. A lot of carbon dioxide then. More than 45. Acidic, alkalotic?
Acidic.
Acidic. So that's the reason why most of the students answered respiratory acidosis. And now you're compensated, uncompensated, and fully compensated. Your HCO3 will judge that. Did your HCO3 in this case did something? Did it give flowers to your body to say, okay, I'm really sorry, I would like to help you, I'll try to neutralize your acidity? Did it do something?
No.
No, because your normal HCO3 is 22 to
26.
26, and that is normal. It means to say it's uncompensated. Well done, beautiful. Unmute, Carissa.
Sorry. Okay, let's try this one. pH of 7.5. What is it? Is it, let's look at the pH level here, 7.35 to 7.45. Is it acidosis or alkalosis?
Acid.
Alkalo-
Alkalosis.
Alkalosis, very good. PaCO2 of 20. So PaCO2, 35 to 45. Is it acidosis, alkalosis?
Alkalosis.
Alkalosis.
Alkalosis. Very good. HCO3 of 25.
Normal.
Normal. So which one sings together? The lungs?
pH and
Yeah. So the lung sings together with the pH. Therefore, this is called respiratory
Alkalosis.
uncompensated
alkalosis.
respiratory alkalosis.
Did the kidneys do something there?
No.
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 Okay.
Therefore, it is called
Uncompensated.
uncompensated respiratory
Alkalosis.
alkalosis. Is that clear now for everybody?
Yes.
Yeah. Shall we proceed to the next one? Because it's going to be trickier as we go on. All right. This one, Karen.
Okay, so let's try to analyze together. So in one look, what is your answer here? Let's try if you got it right immediately. What is your answer here?
Metabolic acidosis.
Okay,
Wait. Uncompensated.
so that's
Because
your
this is here.
so you're saying
Yes,
it's
yes.
metabolic acidosis uncompensated. So let's try
Mm.
uncompensated. Okay, so let's try to analyze together if it's correct. Let's say, okay, you could actually answer immediately and flex in one click and one glance. So pH 7.22, acidic or alkalotic?
Acidic.
Acidic.
Okay, acidic. PaCO2,
Acidic.
It's normal.
it's normal.
Normal.
Beautiful, normal. HCO3,
It's
Acidic.
acidic.
acidic. So as what Carissa mentioned earlier, who sings together? It's your kidneys and your pH. So you have an acidic here. So you have your metabolic acidosis and your PaCO2 did not do a thing. It was so lazy to do a thing, or it just didn't care. It was uncompensated. Well done.
Thanks, Karen. Now let's try this one, 7.48. So we have a pH level of 7.35 to 7.45. So the higher the pH, the more acidic or alkalotic it becomes.
Alkalosis.
Yeah, so this is alkalosis. Is that correct?
Yes.
Yes.
PaCO2, 33 to 45.
Normal.
Normal. HCO3, 22 to 26. So it's
Acidic.
more than 26.
Alka.
alkalosis.
Alka.
I like
it.
Okay, alka.
Okay, so who sings together? Your kidneys and your pH of alkalosis. Therefore, this is
Metabolic alkalosis.
Metabolic alkalosis.
Metabolic
metabolic
alkalosis. I like it. Somebody said uncompensated. Why? Because the lungs did not do anything to make it more acidic. Is that correct?
Yeah.
Yes.
Okay, so I think we're all confident here now. Let's do a little bit of a tricky one.
So let's look at this. One glance, what's your answer? One glance, and then we try to analyze together. No answer?
Wait.
Try. Nothing wrong in trying.
It's
Metabolic acidosis partially compensated.
Partially compensated. Let's see if it's indeed metabolic acidosis partially compensated. Let's look at the pH. Your pH is less than 7.35. So definitely says correct. You are actually in the right track because it says acidosis based on the answer of the many. So let us look at your PaCO2. It says it's 20. So is it acidotic or alkalotic?
Alkalotic.
Alkalotic, okay. Let's look at your HCO3. Is it acidotic or alkalotic?
Acidotic.
Acidotic. So as what Carissa says a while ago, who is singing together? Your pH and your HCO3. HCO3 is responsible for metabolic aspect of your body. So it says it's metabolic acidosis, okay? However, okay, the question is your lungs trying to do something?
Yes.
Yes, your lungs was trying to do something. Definitely it's partially compensated because it was not successful. As your pH remains acidic, it did not go normal, but your lungs did something. It made an effort. It tried hard, but it did not succeed. So well done. It's metabolic acidosis partially compensated.
Let's try the next one. Okay, in one glance. I like that, Karen. In one glance, what is it?
Respiratory alkalosis
Metabolic alkalosis partially
or
compensated.
partially compensated.
Okay, so one said it's respiratory alkalosis. The other one said metabolic alkalosis. So let's have a look. And somebody said it's partially compensated. Is that correct? Yeah, let's analyze. So 7.48, acidosis, alkalosis.
Alkalosis.
Alkalosis. PaCO2 of 28. Acidosis or alkalosis?
Alkalosis.
Alkalosis. Yeah. HCO3 of 30.
Alkalosis.
Alkalosis. Okay, this is a tricky one, isn't it?
Yep.
Yeah. So in that case,
Yeah.
7.48, PaCO2 of 28, HCO3 of 30. How would we know whether or not it's respiratory or metabolic?
I don't know.
So in this case, if there is none, 7.48, all are alkalosis, no one is helping each other, then you need to know the diagnosis of your patient. Okay?
Respiratory, metabolic, alkalosis, uncompensated, I think.
Sorry?
RM alkalosis, uncompensated.
So this is actually uncompensated because no one is trying its best because we don't know whether or not it is whether or not it is alkalosis. But if you look at here on the upper right side, you can see here that you need to know your patient's history. Okay, so in this case, NCLEX will not actually give you this kind of problem. Okay, because this one is unsure. NCLEX will not give you a problem where it is very tricky. In this case, you won't know the answer unless you have your patient's history. So that is the next one there, which says know your patient's history. Okay, if NCLEX did not give you a patient's history and only gave you that, that is an invalid question, but NCLEX does not have invalid question. All of their questions are measured. So that's just a trick for you. So know your patient's history. Now in your NCLEX question, the NCLEX question actually says here that your patient has a nasogastric suction. So what will be your answer?
Metabolic.
Metabolic alkalosis.
Metabolic alkalosis. Now, what if NCLEX gives you a situation where your patient is on a ventilator?
Respiratory.
Then it becomes a respiratory alkalosis. Okay, but no one is trying its best. Everybody is still alkalotic. Therefore, it is still uncompensated. Okay, so again, it is very important for you to know your patient's history. Most of the NCLEX questions will actually give you a patient history. There are times when NCLEX will not give you a patient's history, and that's where you check whether or not your pH level is in the acidotic side or acidic side or alkalotic side, or the or more than between 7.40 to 7.45. Okay, did everybody get that?
Yes.
Yes.
Yeah. Okay, so this one will be the tricky part.
So let's proceed. As this is the tricky part, that's what Carissa has said. This is scary. So in one glance, let's say if we could get it in one go, what is your answer here? Just one glance.
Respiratory acidosis fully compensated.
Respiratory acidosis fully compensated.
Let's see if it's correct. So let's see. pH, is it normal?
Yes.
Yes.
Definitely, it's normal. Okay. PaCO2,
Acid.
High acidic.
acidic, beautiful. HCO3,
It's high
Alka.
alkalotic. Yes. And what did Carissa mention earlier? Your body will not overcompensate. So your 7.34 is in which side?
acidic side.
Beautiful, acidic side. So when you say your body or your pH is in the acidic side, because it's between 7.35 to 7.39, it is still normal, but the acidic side of normal, okay? So who is on the acidic side? Your PaCO2 or your HCO3?
CO2.
CO2. So it means to say it's your lungs. So that's the reason why your answer is respiratory acidosis, fully compensated. You got it right. Well done.
All right. I can't see everyone now. Okay, so let's try this. We have 7.43, PaCO2 of 48, HCO3 of 30. So let's have a look. 7.43, is that normal?
Yes.
Yes.
Yeah. Let's see if there is something abnormal here. So PaCO2, what is it?
Acidotic.
Very
High, it is alkalosis side.
So PaCO2, when there is more CO2 in the body, is it acidosis or alkalosis?
Acidotic.
Acidotic, yeah. HCO3 of 30. So we can see here 22 to 26. So the more HCO3, is it acidosis or alkalosis?
Alkalosis.
Alkalosis. Now, is this an acidic side or alkalotic side?
alkalotic.
Acidic.
Yep,
Alkalotic.
alkalotic side. So how would you read this then?
Fully compensated. Metabolic alkalosis.
Alkalosis fully
Yeah,
compensated.
so it's the kidney, so it's metabolic alkalosis because it's on the alkalotic side, but the CO2 actually is making an effort to make it more acidic, but did not succeed. Is that correct in saying? Yeah. Therefore, this is metabolic alkalosis, but fully compensated. Did everybody get that? All right. So let's try some NCLEX questions. These NCLEX questions are taken from resources that we trust and we love as well. This is taken from, we'll show you the resources later, but Karen and I love these resources. So let's start.
So start with question 1. Our first question states that the client has a nasogastric tube connected to intermittent wall suction. The student nurse asked why the client's respiratory rate and depth has decreased. Blood gases were taken, so pH 7.46, 7.46, PaCO2 33, HCO3 29, PaO2 80. What is the nurse's best response? What is your answer here? A lot of like silence. Try to analyze, ladies. Try. Nothing wrong in trying.
2.
Okay, we have number 2. Why do you think number 2 is the answer here, Sess?
Because it's metabolic alkalosis. Since they were doing suctioning, the PaCO2 trying to compensate to make it something, what you call that.
Well, you've
But
got it.
it's nice to hear the 2 when it's like therapeutic calm.
Okay, I really love that. You've used your therapeutic communication in place. You've actually analyzed the concept. But what we're going to do here is we are going to dissect the question. And Sess has actually was able to highlight on the patient's condition. Patient was actually attached to a nasogastric tube. Okay, patient was attached to a nasogastric tube. Okay, and also to an intermittent wall suction. So with the knowledge that you have taken from us earlier, we are trying to analyze what is the patient's condition right now. Is pH is 7.46. What is that? Acidotic, alkalotic?
Alkalosis.
PaCO2, what is that? 33. Alkalotic
Alkalotic.
or acidotic?
Wait.
Alkalotic.
Yeah, alkalotic.
Alkalotic. Okay. And your HCO3 is what?
Alkalotic also.
Sorry?
Alka.
Alkalotic as well. And
Alka,
remember, alka, yes. So remember what Carissa has mentioned earlier. Actually, she gave an example with alka, and as well said alka. You have your nasogastric tube here connected, okay, with intermittent wall suction. So what do you think is the issue here? It's talking about an issue in metabolic, intermittent wall suction, nasogastric tube. So you have a metabolic alkalosis, okay? Metabolic alkalosis, uncompensated. And let's try to eliminate others. Why you could say, you know, why we should not choose those? Because in NCLEX, you have to understand why you have to eliminate the rest, and you will have higher chances of, you know, having a 50% or even 100% of having the right answer. So number 1, so it's common for clients with uncomfortable equipment such as NG tube to have a lower rate of breathing. So Sess has mentioned earlier, it's trying to compensate because the patient here is why the client's respiratory rate and depth has decreased, because it's trying to what? What's happening here? It's trying to what? It's trying to compensate. Okay, it's actually trying to compensate. It's trying to retain more carbon dioxide in your body because you have alka. So you just don't say that, you know, it's normal. You have to explain further. thereby this is not a answer. Let's check number 3. Whenever a client develops a respiratory acid-base problem, decreasing the respiratory rate helps correct the problem. So the thing here is that it actually tries to explain that whenever there is a problem with acid-base balance, but the thing here, it's talking about the respiratory acid-base balance, and the problem here is actually metabolic acid-base balance. The cause was metabolic, and the statement was talking about a respiratory acid-base balance. It is your respiratory who is trying to compensate the metabolic problem, okay? So that's number 3 is not the answer here. Number 4, let's see. The client is hypoventilating because of anxiety. You already have the word anxiety. It was not because of anxiety. It was hypoventilating because it's trying to compensate and retain more carbon dioxide because there was a metabolic alkalosis. Does it make sense? Okay, so that's how you are trying to eliminate, you are trying to dissect the question when you are going to answer an NCLEX question.
All right, let's proceed to the next question. The student nurse under the supervision of an RN is reviewing a client's arterial blood gas results and notes an acute increase in arterial partial pressure of carbon dioxide, which is 51 mmHg compared with the previous results. Which statement by the student nurse indicates accurate understanding of the acid-base balance for this client? So option 1, when the PaCO2 is acutely elevated, the blood pH should be lower than normal. This client should be taught to breathe and rebreathe in a paper bag. Number 3, an elevated PaCO2 always means that a client has an acidosis. When a client's PaCO2 is increased, the respiratory rate should decrease to compensate. What is your answer?
Don't be shy. It's okay to be wrong. That's the reason why we're here, because we're learning, and we're happy to hear your thoughts actually.
It's a PaCO2 increase. That means it's alkalosis.
Acidotic.
So that's a 2 is the answer. Number 2, this client should be taught to breathe.
Okay, so somebody answered number 2. Any other answers? I can see Diksha shaking her head. Okay, so let's dissect this question. When we say dissect, let's see what is actually NCLEX is asking us. Okay, so the question here is, which statement by the student nurse indicates accurate understanding of the acid-base balance for this client? It's talking about accurate understanding. Therefore, what we are actually doing here is
a positive event inquiry.
Yes, it's positive. It should be something that is correct. Okay, if the question here says which indicates further teaching, that means your answer should be a negative answer. Okay, this time it is asking for accurate understanding. So it should be the positive answer. It should be something that is correct. All right. Now, what are we looking for? So we are looking for an acute increase in arterial partial pressure of carbon dioxide. Okay, so it's not a long term, it's an acute, it's something recent. So what is the normal PaCO2 level?
35 to 45.
35 to 45. What does it mean then? It's 51.
It's acidosis actually.
It's acidosis. Okay. When there is acidosis, what happens to our patient? There is high retention of CO2. All right, so let's check each of the question. There is one question, what we call the absolute words. Okay, absolute words are always, never, none. What else? always, never, none, all. And which part of this question has absolute words?
Number 3.
Number 3. An elevated PaCO2 always means that a client has an acidosis, which doesn't make sense because sometimes when the PaCO2 is actually compensating, it could have a tendency that it will have high levels. So can we eliminate this then as an option? Yeah, so let's eliminate this because this is an absolute word and it doesn't mean that when a CO2 is always high, it means acidosis. It could be a compensatory mechanism as well. Yeah, all right. Now we have an acidosis. So let's have a look at each question. When the PaCO2 is acutely elevated, the blood pH should be lower than normal. Is that correct? When the PaCO2 is 51, the blood pH level should be less than the normal, 7.35 to 7.45. Is it acidosis?
Yes.
Yes. So that means what it's trying to say here is if there is high pH, then when there is high PaCO2, then it could be acidotic. Yeah, so we can consider this answer. So we can leave this answer here just to make sure that all the other answers are wrong. This client should be taught to breathe and rebreathe in a paper bag.
Could be because it's retaining more carbon dioxide.
So if the body is retaining more carbon dioxide, if we breathe in a paper bag, we're actually putting more carbon dioxide in the body. Would you like that to happen? No. Therefore, number 2 is an unsafe answer. Yeah. What do we normally give to this patient? If we don't want CO2 to come into the body, what do you want to give to the patient? Oxygen. We actually need to give oxygen to this patient and not a paper bag. And that's what makes that answer wrong. Which leads to our answer in number 4. When a client's PaCO2 is increased, the respiratory rate should decrease to compensate. So who compensates here? Is it your lungs or is it your kidneys?
Kidney.
Yeah, because this is respiratory. While in fact, in this case, the patient is already hyperventilating. The patient is actually at risk of hypoxia because of a high CO2 level. Okay, so the brain will then signal actually for the lungs to actually breathe more to get more oxygen. So it's not a decrease in respiration. Did you all get that? So we need oxygen first because the patient is at risk of hypoxia because of a high CO2 level. We need oxygen. We don't need the rebreather bag, but also the compensatory mechanism is not the lungs. The compensatory mechanism there is the kidney itself, and that's what makes a statement wrong. If you have to analyze then, in a case of a 51 mmHg of or millimole per liter, depending if we're using American or Australian, but they're the same. PaCO2 is actually 51 of PaCO2 is actually high in carbon dioxide already. So the patient is actually breathing more to get more oxygen. Okay, so that makes statement number 4 wrong. So you can see that 1 and 4 are very close, but then you have to also think that in the buffer system, who actually saves the lungs? It is the kidney. Therefore, number 1 here is the answer. Who got this right in their thinking? Everyone is on mute, so we really couldn't hear. All right, let's move on to the next one.
Okay, for the next question, it states here, a nurse is caring for a client diagnosed with post-operative atelectasis, and the client's arterial blood gas result indicate uncompensated respiratory acidosis, which finding supports this diagnosis. So we are going to put into mind what NCLEX was asking us again. We always go back, what is NCLEX asking me in this question? So you are going to find out uncompensated respiratory acidosis. Immediately we go to the process of elimination, because number one thing is that you are actually competing with time in your NCLEX. So when you say respiratory acidosis uncompensated, when you look into, I could see already Seth very quick, Seth answered in the chat box. She said 4. So when you say respiratory acidosis, let's see, Seth, if you got it right. Let's look at the pH of everybody. Who do you think which numbers do you think we could eliminate? Which is not acidotic?
1 and 3.
Beautiful.
One.
Immediately you could see there 1 and 3. Now you have 50% chance of actually acing your test because you have only 2 and 4, which is left at your choices. So now you are talking about respiratory acidosis. You have identified your pH of number 2 and number 4, which is acidotic. Let us look at the PaCO2 immediately. Which PaCO2 do you think is on, let us say, acidotic?
48, PaCO2 48. Number
So
4.
you could see here that your PaCO2 48 is actually acidotic. Here, what do you see here? This is, what is this? 7.35. I mean 35, sorry.
Normal.
This is normal.
Normal.
Are you able to eliminate immediately number 2? Let's see your HCO3 just to be very sure, because of course you already have a normal PaCO2 here. It's not doing a thing, therefore it's uncompensated. So you have number 4 as your answer. Is that quick? Immediately you are able to eliminate 2 answers by the process of elimination. And that is very important when you do your NCLEX. Okay. Sorry, Carissa, we couldn't see the screen. Thank you.
Is that, am I sharing it now? Am I sharing it?
No.
No, it went away again.
Sorry. This is the user problem. This is not technical problem. How's that? Is that better?
Yes, 100%. Yes.
Okay. All right. So let's look into this question. So a nurse is caring for a client admitted for increased blood sugar level of 265 milligrams per deciliter. The client's arterial blood gas indicates fully compensated metabolic acidosis. Which findings support this diagnosis? So let's have a look. What do you think is happening here? What do you think is happening to the patient? Anyone? Anyone's got a clue?
What's it called? DKA, something.
Yeah, DKA. Diabetic ketoacidosis because of a 265 milligrams per deciliter of blood sugar. So therefore, the body is releasing the ketones at this stage. So the client's arterial blood gas results in indicate fully compensated metabolic acidosis. So what is NCLEX trying to ask us? Which one is a fully compensated metabolic acidosis? Okay, so let's go to what is fully compensated. What does it mean?
pH is normal.
pH is normal. So let's not waste our time to abnormal pH levels. Is that right? Yeah, so let's eliminate all abnormal pH level. Which ones are abnormal pH level here?
2 and 3.
2 and 3. So let's take out 2. Let's take out 3. Is that right? Yeah, so we have 1 and 4 to actually analyze. So what is our patient's diagnosis? Metabolic acidosis. Is that correct? So therefore, they're all fully compensated, but knowing your patient's history and knowing that it should be in the acidic side because of the nature of your patient's condition. So we are more likely to lean into number 4. Is that correct?
Yes.
Yeah, but let's have a look at number 1 because we really need to make sure that this is actually not right as well. So in that case, metabolic acidosis, we're looking into the metabolic side, HCO3 of 20. What is the normal HCO3 level?
22 to 26.
To 26. If it's acidotic, it should be less than 22. Is that correct? Is this correct? Is it less than 22?
Yes.
Yes, it is. However, in this case, our CO2 remains normal. Even if it's gone to a normal alkalotic side, we can even see here because it's 35 to 45, isn't it? So does that make sense? Not as well, because it is number 1, alkalinic side. Number 2, if it's fully compensated, PaCO2 should be doing something there. Yeah, so that doesn't make sense. That answer is actually not, it doesn't make sense, okay? It's an alkalotic side, okay? So then we will eliminate that, but we have to make sure that number 4 as well is correct. So in that case, is this acidotic, HCO3 of 16? Yes, it is acidotic. In that case, is the CO2 trying to make the body alkalotic? Yes? No? What's the normal CO2 level?
35 to 45.
35 to 45.
The more CO2, the more acidic it becomes. The less CO2, the more alkalotic it becomes. Is that correct?
Yes.
Yep. So it is actually doing something. Okay, it is making the body more alkalotic. Is it successful?
No.
Is it in the acidic side? What is your normal pH level?
35 to 45, 7.35.
Is that fully compensated then?
Yes.
Yes.
It is successful. It is in the acidic side. Therefore, number 4 is our correct answer. We do have references, and these are the references where we got this all information from. So, and these references actually are in the students portal as well. So these are what we recommend our students to actually read as well, because there are a lot of readings and a lot of exercises in there. But let's have a whistle back. So this time I'll stop sharing. Karen, is there anything else that you'd like to add?
Oh, so far so good. I'm not sure if the students has any question, but let us know if you have one. And I really like acid-base balance though, so I enjoy this topic. Yeah.
Do you have any questions? Silence means yes, silence means you understand. Now, what we need to do is we really like whistle backing. We need to make sure that you're able to whistle back at least one learning for today. There are 23 participants. So in this case, we would like to at least have 23 new learning or knowledge. And this is how we actually check our students' understanding. So let's start with Hisila. I know that you're on mute, Hisila, but if you would like to tell us just one learning for today.
Yeah, I learned many things. but I want to say that I didn't know that hydrogen, if it's lost, then it's like it's a acidic site. I didn't knew that. So yeah.
Just a bit of clarification in that. If you're going to see the, maybe we missed that out. Carissa, will we be able to go back to the buffer system? Yeah. Yeah, you could see here, maybe it was missed a little bit. You could see here, there's a picture here regarding hydrogen ion concentration in the solution. So if there is increased H plus, so it is becoming acidic. If it is decreased H plus, it's becoming alkalotic. Just a little bit of a correction in that aspect. Maybe we just missed this one.
Yeah.
Yeah.
Thank you.
I'm happy that you have made that clarification.
Yeah.
Thanks, Hisila. Pravina, one learning for today.
Now I'm more clear about compensation and partial compensation and fully compensation, because it was a bit confused before. So now I'm more clear.
Thanks, Pravina. Karen, we have two Karens here. Karen with a C.
Hello. What I learned are about the uncompensated, fully compensated, and partially compensated. That's already clear to me that as long as the pH is normal or abnormal, that's where I'll base if it's fully, partially, or uncompensated. So that was really clear to me today.
Thank you. Diksha.
I have learned that in metabolic alkalosis, there is a loss of hydrogen, calcium, and potassium ions. If there is any loss of those electrolytes, we can say that it's metabolic alkalosis.
Perfect. Bharat. Bharat is frozen. Vera.
Hello.
The
Yeah.
pH is normal.
Sorry. So I could learn many things here today, is especially about the birth system, that we can understand when the lungs is not well succeeded, he needs more help, and the kids will try to help as well. And everything makes a sense. So in the body system, and especially the examples that you give us about anxiety that we can go through to the respiratory alkalosis, or we see a patient with diarrhea, we can go specific for metabolic acidosis. So we can organize the ideas and think about what the patient has at the moment and how we can help it. If we give more oxygen, or if we give paper bag because anxiety. So yes, it's well explained, and yeah, I'm happy with all explanation that I had today. Thank you.
Perfect. Thanks, Vera. Ripal.
Sorry,
You're on mute.
You are on mute, Ripal.
I have learned so many things today. The main thing that like I was confused before, it is like when everything is same, all the like thing is same direction, and no one is helping each other. That time we have to see the patient history. So that one I have learned for first time here. So yeah, that one is.
Thank you. We have Cess.
Hello, I've learned a lot today, so especially in reading a one glance only, because I usually write it and analyze something for me to get the answer, but it makes my mind, that one glance word, it's make my mind crazy. Something, and we are, hurry up, you need to answer that one. So that's why. And then I just learned that I need to need to know the patient history, especially the one that you gave us, the 2 acidosis, I think, respite and metabolic, but we didn't know the patient history. Then we didn't know the answer also.
Yeah.
So
And
it's really matter that the English comprehension something.
Yes.
Or
Thank you very much, Cess, for raising that up. NCLEX is always a measured test, and it will not trick you at all. So it's very direct questions, and that's the reason why we've also added that, because students will say, "Oh, what if it's this one, and what if it's that one?" One thing that we can assure is that NCLEX is a very measured test. It's a very valid test as well. So there should be a patient's history, and if you don't have the patient's history, there shouldn't be a trick as well in answering those questions. It should be direct and straightforward. We do have Catherine here. Hi, Mom Carissa and Karen. Thank you for this study session. I find it very informative. I will be contacting you soon for potential enrollment. I just moved from Brisbane 2 weeks ago and updating qualifications training like first aid and applying for jobs. Well done, Catherine. My target date of starting my NCLEX review is on the 2nd week of March. I'm leaving now for my house inspection. Thank you again. Have a great day. Good luck in your house inspection.
Good luck,
Hope you'll get
Catherine.
it. All right. Thank you so much, everyone. I know that we still have a few more students. We are on the dot 12. So thank you so much for all your participation and also for your contribution. It is such a great lesson when everyone is very interactive and everyone is participating. And that's why Karen and I love acid-base balance, because aside from the knowledge that you get, is actually the interaction that you get from the student. So thank you so much. We will be in touch with you soon. If you have any questions or if you would like to contact us, please feel free. Our email address is info@nursingeta.com. You can also visit the website for more information. So thank you very much all. You all have a very good lunch. I know that you are all hungry, and make sure that you maintain your acid-base balance and wash your hands